We are live. Thanks.
Okay. Hi, everyone. We're just starting our webinar. Thank you so much for joining. My name is Nikki Gomez today. I'm very excited to have a lively discussion about PCOS, or sometimes known as PCOD, polycystic ovary syndrome or disease, the leading cause of infertility today, which can be treated through medication or through lifestyle changes. I founded a company called Maximize Me because I went through infertility treatments myself, IVF, a few years ago. And what I found was that most clinics are brilliant with the medical side, but patients don't know a lot about what they should be doing on lifestyle changes. And this evidence is out there to show that lifestyle has a massive impact on our ways of conceiving, up to 55% based on a Harvard Medical School study. I myself have an MBA from MIT, and I'm in the US, and I'm further qualifying as a functional medicine health coach. Now, today I am joined by two amazing doctors. There's Dr. Parinaz Parhar, who has over 8 years of experience in fertility as a specialist and clinical head at Oasis Fertility in Secunderabad. Welcome. She also has a master's in obstetrics and gynecology and has done a 2-year fellowship in reproductive medicine. She has co-authored a book called The Art and Science of Assisted Reproductive Techniques. So welcome to Dr. Parinaz.
Thank you, Nikki.
To have you here.
Thank you.
Hi, and then we have Dr. Preeti Nanda Siebel, who is India's leading functional medicine expert. She is part of Maximize Me. She's an Indian MBBS doctor who is further qualified with a fellowship in functional medicine and anti-aging from the George Washington University in the US. She's also written 2 books on cyclic keto and the 4-hour rapid fat loss diet. So, welcome to you both. Welcome, Dr. Preeti.
Thank you, Nikki. Thank you very much.
Great to have you. So I'll just tell you the format of today's session is that I will host discussion with you two for about 25 minutes. Then I will try and break down as well the medical speak for us non-doctors so everyone can understand. Post that, I'll be taking questions from the audience. So all of you in whatever channel you're on, if it's YouTube, Instagram, Facebook, Twitter, please put your questions into the chat. You can start now and we will take them after the speakers have done their intros and spoken for about 20 minutes. Okay, so let's get started. So today we're going to look at ways to treat PCOS and help you get pregnant. Now, one way is via medications, which treat the symptoms. The other way is to change your lifestyle and to address the root causes. So which is best? Let's get started with Dr. Parinaz. So Dr. Parinaz, you have a lot of experience in fertility issues and treatments with Oasis and other places. Could you tell us, please, what is PCOS and why is it so important to treat it if you want to conceive?
So PCOS basically stands for polycystic ovarian syndrome. It's the most common reproductive endocrine dysfunction. So you have a lot of ladies who are in the reproductive age group who are currently suffering from this particular disorder. You can almost say almost 7 to 10% of the population in the reproductive age group is suffering from PCOS. Am I audible? Can you hear me clearly?
Yes.
Yes.
If I break up the terminology, it's polycystic ovarian syndrome. So to start with, we thought that these patients just have enlarged ovaries with a number of cysts in them. But as we understood the disease better, we have realized that it has a lot of endocrine ramifications. The disease is commonly associated with hyperandrogenism, which, to put it in layman's terms, is increased male hormone production. So you have females who are producing more of the male hormone. It might be biochemical, that means you just have it being detected in the blood when we're doing the tests, or you might have clinical presentation of it. So these patients might present to us with acne and oily skin, as well as hair loss. So these patients most commonly will present with increased male hormone production as well as insulin resistance. As a result of these endocrine dysfunctions, a lot of these patients present to us with ovulatory dysfunction where they are not releasing the egg every month and as a result having irregular periods. So that's the main cause why they present to us with infertility. Almost 70% of these patients with PCOS will end up being infertile. And that's predominantly because of their ovulatory dysfunction, where the egg is not getting released from the ovaries every month on time. So that's the main reason why they present with infertility and why it needs to be treated.
Okay, great. That was very clear for us non-medical people. So thank you. So you've said a bit about how you know if you have PCOS, like acne and oily skin and insulin resistance. How would you diagnose it at the clinic?
So see, it's basically it's a disease where the presentation is very heterogeneous. It's not that you have these 2-3 things and everyone is going to present with them. So there are a spectrum of symptoms, and patient might present with them with varying severity. So the most common ones are that you might present with, like I told you, increased male hormone production. So these patients have excess acne or hair growth on the face or oily skin. Most commonly, they present to us with ovulatory dysfunction. That means they are having irregular periods, or you have young girls who have not had their menses yet till the age of about 16 years. Some of them present with hair loss, sudden weight gain. So these are the most common presentations. And quite often when we go into a scan for these patients, we find that they have bulky ovaries, where the volume is increased to more than 10 cc, and they have a polycystic appearance. So if I were to say, if there are like these 3 basic classifications, if you have irregular periods or absence of periods, that's the first thing. The second main symptom would be if you have any of the presentations of increased male hormone. And the third one is if you have polycystic ovaries on ultrasound. So according to the most commonly applied diagnostic criteria for PCOS, if you have any 2 of these 3, you can be categorized as PCOS. So we have patients who present with all 3 of them. We have patients who present with any 2 out of 3. So to put it very simply, that's the way we diagnose our patients.
Okay.
70% of the patients with irregular periods would be the ones who would be having PCOS. So yeah, it's that common.
Okay. All right. And and you said it, if about 70% are infertile in the sense that they are not getting regular periods, so are not releasing the egg. Can you talk a bit about, is it possible to have PCOS then and have a successful pregnancy?
Now, Nikki, like I said, PCOS is something which can present with different severity. So you might have very mild cases where it's there, it's dormant, the patient doesn't even know she conceives spontaneously. And on the other hand, you have patients who requires like the maximum amount of treatment we can offer, and they're still having difficulty conceiving. So yes, it is possible to have a pregnancy with PCOS if you're one of those fortunate few who are having regular periods, or your disease is under control. But for most of the patients, because the ovulatory dysfunction is so common, they do end up needing help in various forms, starting from right in the beginning to lifestyle to even medications and maybe IVF for some. The most important thing to understand is that it's important to tame this condition before we set out on the treatment. Before we start any approach, it's because it's an endocrine dysfunction. Main therapy is oriented at trying to get the hormones under control. Because if you don't do that preconceptionally, you pose the patient at a high risk of developing conditions like diabetes and hypertension in pregnancy, and they're very prone to preterm labor as well. So it's important that if you want someone to have a healthy pregnancy and a healthy baby, you try and control their condition, tame it before you set out to give them the final treatment. So preconceptional management is very important in these patients.
Okay, great. So it really outlined how important it is to treat PCOS, not only because of the ovulation reason, but also for other things like diabetes and other risks of disease. Okay, thank you for that, Dr. Parnas. We're going to just move on now to Dr. Preeti to ask you a few questions. So Dr. Preeti, you have a lot of experience first as an allopathic doctor and then as a functional medicine doctor. Can you tell us a bit about your approach to treating PCOS using functional medicine, and also actually what functional medicine actually is?
Exactly. So basically, Nikki, functional medicine works on the cause of the problem. And if we look at PCOS, there are 3 major causes which we think we have to look into. The first is the gut health. Generally, we will find in PCOS girls, they would either come with history of constipation from a very young age. Now, constipation in itself tells us a lot of things. It could be deficient of magnesium. It could be a lot of stress. It could be imbalanced thyroid. It could be less water intake, and it could be less fiber. As it is, we know that, majority of the population today is taking not even 50-60% of the required fiber, which we must take. Right. So that is the first. So gut health is what we believe that's the first thing. Generally, about 50-52% like this also have irritable bowel syndrome. And then we start working on that. Second, of course, as a cause, we think, how is their liver detoxifying? Is their phase 1 active? Is their phase 2 active? And there could be genetic and environmental causes, both, which could be making an impact there. The third cause, which we think is, of course, hormonal imbalance, insulin resistance. Dr. Parnaz has very beautifully talked about that. But what I see in my practice very commonly also is adrenal fatigue. So generally, we know that there is a lot of data suggesting that cortisol levels are erratic or imbalanced in these women. DRS, which is again another androgen, but which works with cortisol in a swing way, that also is imbalanced. But what I see in my practice is a lot of these girls come with low cortisol or erratic cortisol. They will have low cortisol in the morning, but they will have high cortisol in the evening, which hampers their sleep, which hampers their moods, which hampers the other hormones.
Right, and cortisol is a stress hormone, just for everyone to know. Yes, so these are people. So for this, right. Sorry, go ahead.
And last and very importantly, we also look at toxins. See, why I started believing in all this is, I am 1989 batch Amritsar Medical College. And I very clearly remember, and I think Dr. Parinaz will agree with me, those days we never used to have so many PCOS. It was not easy to find PCOS patients in the OPD to actually understand how this PCOS girl looks, how she behaves, what are the things we have to look at, when we treat PCOS or when we diagnose PCOS. And over these last 25 years, there has been some changes in PCOS that now almost every alternate or, girl or 1/3, I would say, and Dr. Parinaz can actually correct me with the data she sees in her clinic, but these are the number of girls who are experiencing PCOS today, right? And a lot happens because of toxins. One, the environment you live in, so how much toxins you take. Also, second, how much toxins your body is able to eliminate. So that's also what we look at. And then the fifth, but a very, very common reason I find is food insensitivities. This is, 5 years back when I started functional medicine, I was in a gynae conference in Gurgaon. And before that, I was instrumental in taking, Foxy Journal on PubMed. So because of that, I knew some doctors and I went in this conference and there was this lifestyle session going on. Everybody said, somebody was talking about leaving gluten and I stood up and almost fought that, we Indians have been eating gluten for so long. Why should we leave gluten? We don't have to follow Western world in everything. We have to use our mind also. No need to leave gluten and all. And in the last 5 years, I've seen some amazing transformative stories, especially in PCOS girls, where they left gluten and their periods became normal. So not for everybody, but for some, it was really magical. So if I have to tell you a story, we had this group program on PCOS where I was doing elimination diet. Now this girl eliminated gluten for 21 days and she started feeling light, happy, sleeping better, menses came on time and all of that. And then she introduced gluten. In 2 days of introduction, Dr. Parinaz and Nikki, she gained 3.5 kgs. So when she had a consultation with me, I asked her, what was your take home from this program? Because this was a group program. She said, Dr. Preeti, even if somebody forces me to eat gluten, I will not eat gluten. Dr. Preeti, I lost 4.5 kgs in 3 weeks and I gained 3 kgs back in 2 days. I will not eat gluten. So what I'm trying to tell here is that somewhere this girl had leaky gut. And because of that leaky gut, she was allergic to gluten or she was not able to digest gluten. And that was then impacting all her other hormones and all. So basically, this is how, Nikki, we look at functional medicine approach. We take detailed history, dig down what is out of these most critical, and start with that.
Yeah.
And of course, we follow. I have a few PCOS girls, with my bends approach, where first thing we work on is breathing. Because as I told you, we are taught ABCD, we are taught cycling, we are taught a lot of things, but somehow, unfortunately, we never taught how to breathe. And in my clinic, when people come, the first thing I do is I tell them, please breathe, take 3 deep breaths. And very surprisingly, all these PCOS girls, they are not breathing correctly.
Okay, so you teach them breathing. Yeah, you teach them breathing.
When we do
like
exercise,
pranayama and breath work, or what?
No, deep abdominal breathing in the right way. Keep it very simple for these young girls.
So the B for bends is breathing. Your
E is exercise.
The E is exercise. Okay. Go ahead.
And maybe we can talk more about exercise then. N is nutritional supplements, because some of these girls are deficient, especially in vitamin D, right? And Dr. Parinas can vouch for it. And vitamin D is so very critical for our immune system, for insulin resistance, for hormonal balancing and all of that. Then comes D. D is diet. So I strongly believe what you put in your body can alter your destiny. And I was not the one who used to believe in this, but I think the number of people I have coached and the transformations they've shown have made me believe in this. And last is S. S is again stress and sleep. One night of erratic sleep can make you insulin resistance. There is data to show that. And all these girls, most of them, they sleep at 2 at night. And that is impacting everything in their body.
So let's go to then, what is the type of nutrition, apart from gluten-free, which might work for some people, that you recommend? And how do you recommend it to them? Do you give them a food plan, or is there another way of doing it?
Right. I generally don't believe in giving food plans. I give it as a sample, but I believe in empowering them. We all know there are 2 ways to do things. Either you can serve the fish in the plate and the girl can have it, right? Or the client can have it, or you can teach them how to fish. So I believe in empowering them. So I give them do's and don'ts. And I have very simple do's and don'ts. I use some functional foods like methi water for insulin resistance. There are some lean PCOS who are not able to handle methi water, or patients have much of insulin resistance, but they have a bigger gut problem. Those are the people where we use aloe vera as functional food, right? Then after that, I am very clear. I tell them, if machine made it, let machine eat it. So unless you get out of this packed food business, unless you get out of this food industry which is trying to screw you, nothing is possible. And
so you would say to eat whole foods and natural foods that
real
resemble
fruits which have life. Yes, and foods which don't come in a packet. And third, of course, I tell them seasonal foods are very important. Don't run after foods which have come from West. Whatever you get here is what you should eat.
So eat
if you are in South, rice will help you. But if you are in North, and if you are a gluten thing, even if you're not eating gluten, but chapatis has to be your mainstay. And one very important thing I keep telling these girls again and again is, don't ever diet. You have to eat healthy, and anything which you cannot do for lifelong, don't start it. You will mess it up rather than improving things for you. And I think rest, everything falls in place. You know, you hydrate well, you do the bends approach. And at the end, all these girls say it was not difficult. We just had to remember not to eat anything which is in the packets.
So eat naturally. So tell us, Dr. Preeti, you've worked with about 450 girls, women that you have who have reversed PCOS. Can you tell us about how long this lifestyle changes usually take on average to work?
What I have seen is 3 months is a good time. Right, because first month goes in just seeing whether I can do it or not. After every 2 days, they come with the question, nahi ho raha hai. You know, I can't do it. Or is this right? But 3 months, I can see very good results in these girls. They generally lose about 7 to 8 kgs. And for PCOS girls to lose anything more than 5 to 6 kgs, you know, the other things start to settle down.
Okay, perfect.
And I think Dr. Parinaz will agree with me on this, right? That any 5 to 6 kgs is good. And also when we balance the hormones, when we detoxify them, and, you know, we're working on their gut and liver, huge transformation happens. Huge transformation happens. And as I told you, once they've done it for 3 months, they're not going to quit it.
Yes, because the gut can obviously affect the way you're feeling, your brain health, all of that as well. Isn't that right? So just one more question before I go back to Dr. Parinaz is how do you make these lifestyle changes stick with your patients, with your clients?
So, Nikki?
Oh, just still for Dr. Preeti, then I'll come to Dr. Parinaz with some other questions.
So, Nikki, for me, I'm also an MBA from IIM Lucknow, and I'm a certified executive coach. And I specialize in helping people change their habits and working on their belief systems. So, two things happen. One is to build trust on them. And what I've seen with PCOS girls is I can build great trust with them very quickly. I'll share an example with you. You know, I met this girl, I won't name, and she came to me and we were talking. So my consultations are generally an hour or more. And I asked her, what do you do when you are sad? Or do you feel sad? Or are you very ambitious? You know, we're talking like that. She says, I go to food. I said, why? She said, when I was a young kid, I remember 5 years old, my parents used to called me in front of some guest or something and told me to recite a poem. I was very stressed. And the moment they went back, I took everything what was left there, which was served to them, came to my room and, you know, had it just to calm myself down. And since then, this has become a practice for me. Whenever I get stressed, whenever I want to achieve bigger dreams and I'm not able to, or I'm striving to achieve them, I take food as my rescue, right? And the moment such conversations happen, you know, a lot of trust happens, a lot of trust builds. And I think for PCOS, when it comes to lifestyle, I believe voicing their thoughts is very, very critical to healing them. You know, these are generally the girls who are very ambitious, who want to be in good books of everybody. People matter to them. And unfortunately, nobody has spoken to them about all these things. So the moment they start relaxing, their habits start changing, their cravings go off. And of course, then we do some tests of mineral deficiencies and all. We check chromium, we check iodine, we check heavy metals so that we can help them more with their cravings and mood swings and stuff like that.
So that's interesting. So you use coaching and motivational psychology, behavioral psychology to help people, but also that trust and accountability with you is very key to it. And also you're saying that a lot of PCOS women are high achievers, which is actually something that I've noticed as well.
Very high achievers, one. And I personally feel really beautiful. I don't know why, but I really feel they're very beautiful. And if you have a minute, Nikki and Dr. Parinaz, I want to share how I started working with PCOS in the beginning. Should I? So 5 years back when I was starting my functional medicine thing, you know, I was thinking where to focus on. And I have two sons who are 26 and 24, and I don't have a daughter. So I thought I want to work with young girls. And when I started looking for that, I realized most of my friends who have daughters, they are struggling with PCOS. And that's how I started co-managing, 3, 4 daughters of my friends, and I ventured into PCOS. But I personally feel they are very, very pretty, very, very pretty.
Thanks, Dr. Preeti. I'm going to move now to Dr. Paranaz, back to Dr. Paranaz, I should say. So Dr. Paranaz, how, so you've heard about Dr. Preeti's approach. I'd like to ask you first, how is this approach different to how you would normally treat PCOS in your clinics?
I strongly believe that, PCOS is something which is related to your lifestyle. Yes, I do agree with that part. And because it's something which is going to affect you throughout your reproductive period, it's going to affect different aspects of your life, of your health. It's important to move on to a treatment which you can follow on a daily basis. I might give you medications for a short while to kind of relieve you of the current symptoms, but this is something which it's a disease where you really need to make certain behavioral modifications. And that is what is going to help you with all the aspects that the disease affects. So it's very important to counsel these patients correctly, to make them understand that, see, it's not you are presenting to me with infertility right now, but later down the line, these are the other organs which are going to be affected if your disease is not controlled. So my current treatment is aimed at treating your fertility, but you need to make certain behavioral modifications, some lifestyle changes, so that you have a healthy life in general. So yes, depending upon the anxiety level, I might start the pharmacological treatment. But at the same time, I would encourage my patients to make lifestyle changes, exercise, give them very realistic goals. Have a very target-oriented approach. Tell them that this is the amount of weight loss we are looking at in this time period. Don't make it very unrealistic and tell them, you should just lose so much weight, because PCOS, we're still struggling to find out what is the etiology. But whatever little we know, stress does kind of aggravate the disease, and excessive weight loss is a form of stress. So you have to keep it gradual. You have to be very consistent in your approach. So that's something which the patient needs to understand. And, a good amount of time when I deal with these patients is trying to make them understand what their disease is about. It's not just about infertility. It's about them being at higher risk of diabetes down the line, at higher risk of endometrial cancer if they don't get their periods regularly. So, I might get them pregnant now, but post their delivery, they'll have another 20 years of reproductive life, where again, they are at high risk of all these conditions if they have not made the necessary lifestyle modifications. So it's very important to counsel the patients, make them aware about the disease, and keep their goals very realistic. Encourage them that, in you, more than anyone else, even if you lose, about 5 to 10% of your weight in as much as 6 months, it's going to make a tremendous change. And one of the best ways to encourage these patients is, I tell patients who have ovulatory dysfunction, the ones who come with irregular periods, is, you maintain a menstrual chart. Try to see how frequently your periods are coming. So normally they'll say that, they come in once in 3 months, 4 months. And I'll be like, you start working on your weight loss and on your diet, and you notice the difference. You'll see that your periods are coming a bit earlier. And it is a known fact that if you lose adequate weight, it leads to spontaneous ovulation in quite a few. And you might not even need pharmacological treatment to try and conceive them. So that's the way you kind of encourage these patients, and you try to keep them motivated. And it is a disease where you can tame it. Most of the patients. Well, yes, there are some where they do need treatment and they are very difficult to treat, but most of them, it's worth a try. Because like I said, it's not something which is short-lived. It's something with which you have to live, and it's not reversible. You can control it. You can have some symptomatic reduction. So you need the lifestyle and behavioral modification in these patients more than anyone else.
Okay, that's great. So you that you have this approach that is dual. Let's say that actually you want to work on the lifestyle part, but the medical part can obviously help. Medications can help, but the two together is ideally, or you might not need the medication.
And it's very important to understand. It's very important to understand the psychological aspect of this disease, because it's like a very often neglected aspect. That's something which even Dr. Preeti touched upon. then a lot of them would be having anxiety and depression. And
Yes.
their coping mechanisms to deal with these are the ones which are actually aggravating their condition. So like the eating disorders, all these are coping mechanisms to deal with the depression, the anxiety, the hyperandrogenism. It leads to poor self-body image. And it's like a vicious cycle. The less you understand about it, the more you just keep on sinking deeper into the hole. So it's better, it's like patient education and motivating them are the key, I feel.
And how, Dr. Preeti, before we go to question, sorry, Dr. Parinaz, I'm going to stick with you here, is how do you motivate them? I mean, you work with them personally, or do you recommend experts that they work with, or how do you, get them to lose the weight and de-stress?
So we do have a nutritionist in our clinic to try and guide them specifically for PCOS. But yes, the first consultation with me, because they've come to me, they have a certain amount of trust. They want to listen and hear it from me. So I do take time out to try and counsel them, like I did right now, to tell that this is what the disease is about, and it needs to come from the doctor. Because there is a certain amount, we as Indians are a bit suspicious, why there is some certain amount of, there's something to gain out of a nutritionist, they're trying to sell their product or something. But if the doctor tries and explains it to them that, no, this is the way your disease functions, this is the cause, and this is what it can lead to, there's more trust in it. And they are more likely to stick on to it because, yeah, that's the trust factor comes in. So I would try and explain to the patient, like I just did, about how even a little amount of weight loss would take them huge distances and how important it is for them. But yes, after I'm done with my basic counseling, it would be taken over by the dietitian to try and explain about what are the foods they should be avoiding and how they should be exercising.
Okay, thank you for that. And would you like to comment on Dr. Preeti's approach to the functional medicine approach to this with the Ben's approach? What were your thoughts on what she outlined as to how she treats PCOS? Seems that you echo each other quite a lot. It's not really a debate in that way.
Okay, so about the gut health and everything, I'm not very, maybe to an extent, because these are all stress-related effects. So we're still struggling to really pinpoint, it's a multifactorial disease. It's not that everything is causing it in someone. There are a lot of things which might be responsible. It can be your genetics, it can be your environment, it can be stress, it can be inflammation. So the gut and everything is associated with inflammation and stress and can be possible trigger factors, but they are not yet proven. So it might be there for some. If it helps you out, very good. That's like really good because then you'll have good relief from the symptoms. But yes, I do believe in yoga, pranayama, meditation, exercise, and low glycemic index foods really helping out. So yes, I'm a bit more conventional in that approach, but the one thing that I really kind of promote is pranayama and yoga for these patients. Breathing really makes a lot of difference. And it might have something to do with the amount of stress reduction it helps with. So like you pointed out that the overachievers tend to be because they are the ones who have these kind of, they have a very stressful lifestyle. And they tend to focus on one thing at a time and just excel in that. So that could possibly be one of the things, but yes, that's not a very scientific answer to that. But yes, out of experience, it's probably because of the stress, and yoga, pranayama is going to help with that. Definitely exercise and dietary modification. Yeah.
That's really great that you're both actually in agreement, and you're both saying that lifestyle should happen first, especially yoga, pranayama, stress reduction, and that it shouldn't be something that people feel embarrassed about because actually it's affecting the high achievers. So it's not something wrong with you. It's just that you
need to learn to live with it and cope with it.
Yes.
Also,
yes.
Sorry, Nikki. I just wanted to add something here is, the way I feel PCOS girls should look at their health condition is, when these white-skinned people go to beaches, they have to take care of themselves, right? Because their skin is so sensitive that they get burnt very easily. While we have that advantage, we can enjoy it for a long time before getting burnt and all. So similarly, I think PCOS girls are just a type of people who need to have a certain lifestyle to live at their optimum.
Yes, Yeah, I see.
So rather than thinking that, we are devoid of eating processed foods or we have to exercise so much or stuff like that, it's just they're special. And that's the reason every special thing needs special care, special attention. And that's the way your body needs special care and attention. And you might as well give it with a smile and it will be faster.
We've got a couple of questions from the audience, so let's just go to them. So one is, if my menstrual cycle is irregular, does it mean I have PCOS? And you kind of touched on this, but are there other reasons?
Shall I answer this?
Yes, please, Dr.
Yeah, so it's not necessary that you have PCOS. Like I was saying, about 70% of the patients, it's the most common cause of irregular periods, especially when you're in your teenage, because that's when you start presenting with it. But it's not necessary. Initially, when your periods just start for the first, like about 3-4 years, it's pretty normal for you to have irregular periods. So it's not necessary that if your periods are a bit delayed in the initial stages, it's because of PCOS. Another thing is that if you have certain thyroid dysfunctions or prolactin abnormalities, then again, you can present with irregular cycles. So when a patient presents to us with symptoms suggestive of PCOS, these are some of the common things which we tend to rule out. And if you have some other associated presentations, like if you have excessive hair growth on the face, then we need to rule out some adrenal dysfunction as well. So specifically for your question about periods being irregular, is it really just associated with PCOS? No, but in 7 out of 10, yes. Most common cause is PCOS, but it might not be for everyone. Yeah.
Okay, great. Let's take the next question, which is, if I'm insulin resistant, how will that affect my treatment? PCOS treatment in general. I don't know if she's talking more about a lifestyle or about medication or both. Dr. Paranas, do you want to take that one as well?
Okay. Sorry. So insulin resistance basically translates into the fact that your body is not able to utilize your glucose that effectively. Insulin is a hormone secreted by the pancreas, which is supposed to help your body use the glucose more effectively. So PCOS, one of the etiologies is that the pathogenesis is that these patients present with insulin resistance. Now, the more insulin resistant they are, the more severe the condition is. The more hyperandrogenism, the higher the male hormone levels, the more resistant they are to fertility treatment. And it's not just the obese ones who have insulin resistance, even the ones who are thin, the lean PCOS, have been, as many as 75% of them have been found to be insulin resistant. So it does affect your treatment because it makes you a more resistant case. And that's why exercise and lifestyle modification, and again, your diet is so important, because that can help control your insulin resistance and make your disease less severe and more adaptable to treatment. We have a lot of medications which we have in order to control the degree of insulin resistance, but that should always be combined with lifestyle modifications like exercise, because that is something which you can do daily. So exercise is great to try and control insulin resistance. If you're not responding very well to that, we have medications to try and reduce the resistance for you. But yes, it does make your treatment a bit more difficult. It makes you a bit more resistant to treatment.
Okay, that's great. So it's harder to treat the more insulin resistant you are. Okay, let's take the next question, which is, what is the best diet for PCOS? And we'll put that to Dr. Preeti, although you did touch on it, perhaps you go into a bit more detail.
Best diet, yeah. So according to me, it has to be a healthy eating plan where you do not use processed foods. Functional foods like methi water, like green juices, they help you in detoxifying and they're very good. But what I've seen working very, very well for PCOS girls, unless they are under adrenal fatigue, is intermittent fasting. So 14 hours of fasting or 16 hours of fasting, can give very good results in PCOS girls. But please note, they should not be under adrenal fatigue. Insulin resistance cases, that can really work wonders for them.
Okay.
And one more thing I want to add here in terms of diet.
Other questions?
Initially, we used to say breakfast is the most important meal. You should have breakfast like a king, and dinner. Today also, that has to be the way to eat. And second, your dinner should always happen 3 to 4 hours before your bedtime. And you know how I remember it and how I changed it is in one of my books, there was this image shown that if you have dinner within that 4-hour window of just before sleeping, whole food gets deposited on your abdomen like this and makes a curve like this. So if you eat late dinners, please visualize this and know for sure that your body does not have time to digest it. It's really going to wrap it up quickly and dump it at the nearest possible destination. It's like, if you have guests coming and your room is all full of clothes outside, what do? You don't take time to wrap them properly and neatly pile them up. You just pick them, roll them, and put them in a box so that the person who is coming doesn't see it. That's what your body does to the food late at night. And that's one of the biggest reasons of that weight gain, which we are seeing, and detoxification issues and all of that.
Right. So you're saying it's not just about what you eat, but it's how you eat it, your mood and temperament while you're eating, the amount of times you're chewing, the time of eating. It's all these things that can affect.
I think what is just the start of it. It is when you eat, why you are eating, and with whom you are eating. Because if you are eating just to cover up your stress or just to pass time, because this has become, a good hobby for you, you just start munching whenever you have ideal time or you're thinking something, then that's an issue. And with whom also is very critical. And the way I look at it is, when we go out for dinner, especially candlelight dinners, we really love the food, but we don't eat too much. If one of you has noticed that. Because with whom, the ambience, everything matters when it is food. What is just the start of the thing? It's like you've ordered something at your house. If you don't cook it, after a few months, it will expire or it will get rotten. So what only takes you there, there's a huge bit beyond that.
So, that's a good example with the candlelit dinner. Dr. Pranaz was laughing to that as well. What do you make of that? Of the how and why, the why of eating. Sorry, go ahead. You got out.
It's just about mindful eating. You have to be. It's everything in moderation.
Exactly.
Being mindful of what you eat and just being very moderate, especially with PCOS. Be moderate in your exercise. Be moderate in your stress levels. Be moderate in what you eat. Don't just go overboard with anything. Relieving stress can never be an excuse for what you end up with. So you have to be mindful of what you're doing to your body, because in PCOS, more than anyone else, it has its adverse effects, and it has very far-reaching adverse effects. So I think you owe it to your body to control yourself to that extent. So
yeah, that's a great way. Can we talk a little bit about exercise then? You said to do moderate exercise. What both of you, maybe you can speak a minute each or so on what kind of exercise. You mentioned yoga. Do you recommend to patients?
I absolutely do. I am pranayam. Just take out 5-10 minutes of it out of your life. Just for that, a lot of people come to me and they would be like, we can't take out the time. We can't go to the gym. It's very difficult, and I'm not pro gym. I'm not even asking you to do that. My simple advice would be use the staircase. Don't use the lift. Just make these simple changes. Walk as much as you can, because that's something which you can do daily. Now, we're all stuck up at home. You can't give that excuse that I don't have the gym open for not exercising. So it has to come from within. These simple changes have to be there. Walk as much as you can. Try to cover about 10,000 steps per day. Eat within moderation. Exercise, aerobic exercise is good. But it should be combined with a bit of muscle training. So they usually say that if you're looking at weight loss, you need to be more intense. But again, it shouldn't be to the extent that the exercise is turning into a stress trigger for your body. So it has to be like, if you're looking at maintaining weight, so probably about 75 minutes of moderate intensity workouts in a week is fine. But if you're someone who's looking at weight loss, so a total of about 150 minutes in a week of moderate intensity workouts is good enough. So that's what I mean by exercise, but not something pro gymming or anything. Try to walk as much as you can, and do include some amount of yoga and pranayama in your daily life.
So what? Yes, to build it into a healthy lifestyle in general, and
do something which you can follow on a daily. You're not dependent on someone. You have to make those simple changes in your lifestyle.
Something that you can do on your own and that you enjoy. Dr. Preeti, anything you would add to that?
So I tell my PCOS clients that do safe exercise, and for me, safe exercise is strength training, aerobics, maintaining flexibility, so some exercises for that, and some bit of endurance also. But of course, I definitely agree with Dr. Parinaz on they should never overdo it. You know, in the very beginning days when I started, I got a girl who used to go for 2 hours to gym every day, and her weight was stuck at 97 kgs. And she was not budging that 97. 2 hours of gymming every day, almost not eating anything. So she wanted to join my coaching program. I told her, I will enroll you, but only if you agree to 2 things. She said, what? I said, 1, no gym for next 3 months. 2, you are almost going to eat double than what you are eating now. See, we have to understand, if you don't eat, your body doesn't metabolize, your functions don't happen, and all those functions are critical for a healthy living. Right? And somehow, so I definitely agree with what Dr.
actually under eating. In this case, this person was
under eating. Lot of these girls are.
Yeah.
They will lose weight quickly. But the key to losing weight is, balancing their hormones and taking the toxins away and healing their gut. I also agree with Dr. Parinaz on this. You should never be bullish on weight loss. If you have to choose between losing weight and becoming healthy, having a better fasting insulin and PP insulin, better cortisol levels, of course, 2 should be your choice. The moment all this settles, body is very intelligent. Just trust your body will take you to your ideal weight. The more you stress about it, the more difficult you make for your body to lose weight.
Yeah, that's, you know what, both of you, thank you so much for this. We actually are running out of time because we've been going for 50 minutes so far, and we've answered the questions that have been posted to us. So I'm just going to wrap up here. I'm just going to summarize quickly and say that this has been a great discussion around PCOS, which is the biggest cause of infertility in women today. And it seems to be something that's on the rise. As Dr. Preeti said, it's been growing in the last 25 years dramatically in the number of women, and now it's up to about 10% of women of reproductive age. And it's you can see it through things like increased male hormones. It could be acne, oily skin. It could be irregular periods. But it's on a syndrome, so there are different. There are different ways of it manifesting and different severity levels of it. Now, both Dr. Preeti and Dr. Parinaz come at it by agreeing that the lifestyle is really key. So how do you change your lifestyle and reduce stress, change your diet and increase exercise, but doing it in ways that are long lasting to you? Because actually these are not things that you need to do quickly, because this is a syndrome that can really change, that really will affect your life forever. So it affects your diabetes and even things like cancer later on in life. The other thing to realize is that it's not just to do with getting pregnant. You might be able to get pregnant with PCOS, but it's more something that you need to solve for yourself. I hope that I'm summarizing adequately. Dr. Preeti looks at this BENS approach, which looks at things like breathing, exercise, nutritional supplements, diet, and stress and sleep as ways of dealing with and fixing, reversing even PCOS, which is done for many women. And Dr. Parnas agrees with this for going through fertility treatments. So I think that we just wanted to leave you with, if you would like to work with anybody with somebody on lifestyle changes, please contact us, Maximize Me. Our website is maximizeme.life. It's on the screen now. And any more questions that you can put onto our social media, we will answer here in the next half an hour or so. So I just wanted to thank Dr. Preeti. Thank you so much for joining us, and Dr. Parnas. You've both been amazing. And it's been a really interesting discussion. Not the debate, but more of a really coming together of seeing how you're coming from different angles in a way, but actually you're saying the same thing, which is that lifestyle really affects this syndrome. And the other thing to notice, people who are diagnosed with PCOS, that there's nothing wrong with you. You're special, as Dr. Preeti said. And you're a high achiever, most likely. This is not a scientific fact, but this is something that came up from both of them, that high achievers tend to get PCOS more. So thank you. It was great that you could join us, and we'll see you next time. Thank you.
Thank you so much.
Thank you, Nikki. Thank you, Dr. Parnas.
Thank you, Dr. Preeti. Thank you, Nikki. Thanks so much. Yeah. Have a great
Bye-bye.
day.
Bye, everyone.
Take care.
Bye.